Okay, our presentation today is a presentation on the Preceptor program here at Southeastern Community College, and the requirements and sort of expectations of each of you as a preceptor here for our EMT and paramedic students. At the conclusion of this video, you'll be asked to go to, if you have not already gone, go to a website that will register you as a preceptor and will allow you to get signed up with our program so that you can actually precept paramedic students. To introduce myself, my name is Jim Stefan. I am the EMS program coordinator here. I also teach the majority of the paramedic program. In addition to that, I teach some of the EMT program. So I want to go over some of the things about individual students and how to record those. The first thing that I want to cover here is the difference between being a preceptor for a paramedic and the preceptor for an EMT. There's different expectations for EMT students versus paramedic students. If you have an EMT student in your program, the EMT is expected to have a basic knowledge of how to care for patients. But the EMT student is not a paramedic student. The expectation of a paramedic student is that those students will be able to care for a person as if they were an actual paramedic. So what does that mean? An EMT student, while they can perform skills, they can perform assessments, are going to be in a little bit more of a limited role because I can't expect you as paramedics to stand by and let an EMT assess what may turn out to be an ALS call. So I understand that there's more of a limited role for EMT students than there are for paramedic students. But my expectation of you as a preceptor for a paramedic student is to do that very thing, to stand back and let that paramedic student actually assess that patient. Which brings us to our first real point. I think I cover this again a little bit later, is that these students will struggle at times. There are going to be times in the assessment where they may really not know what's next. And if you as a paramedic preceptor continually bail them out and give them clues, they don't have the learning experience that they should get. No one is asking you to compromise patient care, but having the paramedic struggle a little bit, paramedic student struggle a little bit, there's nothing wrong with that, assuming it doesn't compromise patient care. Obviously, if something needs to be done urgently, I would expect you to jump in and take over if the paramedic student gets in trouble. Okay, that's a little different than the EMTs. The EMTs, you serve still as the primary caregiver. For paramedics, I would like them to serve as the primary caregiver. Now, our program, this is our goal. It's mandated by COA-EMSP, which is our accrediting body. All paramedic programs who use the National Registry test in this country have to be accredited by COA-EMSP. And this is our program goal, to give them entry-level cognitive, psychomotor, and affective learning objectives. Okay, that's our goal. So the stages of the paramedic program, and this is a little bit of background information, but nonetheless, I think it's valuable for you. The first component is lecture. Paramedic students spend the first while of the class, first bit of the class, gaining a knowledge of material via lecture. They learn the skills in the classroom first. After that, they practice those skills and gain a mastery of those skills in the lab. So using either high-fidelity simulation mannequins or low-fidelity mannequins or even task trainers, they learn how to do the skills of things like taking blood pressure, starting IVs, intubating patients, and all of that. To give you an example, before any paramedic student performs the task of endotracheal intubation on a real person, they have at least 100 documented practice successes. In other words, they have 100 intubations that are documented successfully on a mannequin. Okay, so the lab is where they gain competency in psychomotor skills. They don't really apply that knowledge yet, but they're gaining competency. Then they incorporate those skills into a simulated patient encounter. Each of our paramedic students must perform in simulation. Each of our paramedic students must have at least 10 simulations in which they're the team leader and perform the skills that they've learned that they practiced in the lab. They must successfully perform those skills in simulation. Okay? Then the students go to clinical, what we call clinical at least, which takes place in the hospital or other patient care scenarios, not in an ambulance. Okay? This is where they begin to learn on real patients. Now, it is very much assessment and uni-task driven. So it's very much practicing assessments, and it is very much practicing simple tasks like IVs, intubation, injections, 12 leads, things like that, where they practice specific tasks on real patients. Now, what is missing from many, sorry about that, I will snooze that. What's missing from clinicals is incorporation of a plan to take care of a patient. They don't typically do that. What that's really reserved for is the capstone field internship. That's the end stage of the paramedic program. In other words, the last completion milestone of the paramedic program, other than final testing. We have a week of final testing after the capstone field internship. And the purpose of the field internship is for that student to act as a practicing paramedic. In other words, with the oversight of a real paramedic or a certified paramedic, that student will be the primary caregiver for a number of patients. Our students must have 30 team leads as part of their field internship before they can successfully graduate. They need 256 hours and 30 team leads before they can graduate. Beginning this academic year, the 2018-2019 academic year, the last 48 hours of their field internship will be with one single preceptor, and that one single preceptor will do an evaluation of that student. In other words, that one single preceptor will give a frank, honest, open evaluation with the basic idea being, is this paramedic student ready to work on your family? Is this paramedic student ready to work for your service? Okay, not that you like them necessarily, but you trust their skills and knowledge enough to work for your service. Okay, so this is sort of a visual overlap of the classroom part being first, and then the lab, then the clinical, and then the field. Now, the lab and clinical can overlap with each other. The field and the clinical can overlap with each other. Our students, as of this year, start the clinical environment late in the fall semester. Beginning next year, it will be much earlier in the fall semester, fall of 2019. I'll probably use the same video in 2020. So those students will have started their clinicals much earlier, but they must perform the skills in the classroom, learn the skills in the classroom, perform the skills in the lab and in scenario before they can perform the skills on real people. Okay, this you cannot see. I don't know how well you can see it on the recording. This is a list of the skills that these students need. Okay, now between clinicals and field internship, these are the different skills. Now you don't need to be very concerned about this. The students are responsible for documenting these for each of their patients. Okay, so the next thing that I want to cover is the evaluation tool, or the tool that we use to document those clinical experiences. Let me take you to this screen. You should see this screen. The website is platinumed.com. Now, if you've been through this program or a program that used Platinum Ed, you will already have an account. You can certainly use that. If you have not gone through our program or have not gotten an account with Platinum Ed, you'll need to set one up for yourself. So go to platinumed.com and there will be a link to create an account. Okay? Create an account, right? If you click login, I hope this has got my stuff, but create an account, right? Now I know that says create student account, but if you click it, it will go to this, okay? Go to this. That will allow you to set up an account, right? Then you can send me an email to my email address. It's listed right here, jstefan@scciowa.edu. And I will add you to our program as a preceptor. I'll add you to our program as a preceptor. Okay? I will also mark you as completing the training that's required for you. Now I'm going to sign in to my account. Now you won't see much of this because obviously I have multiple roles. But what you will see is platinumplanner.com preceptor. And that's your role for approving student documentation, okay? Approving this. All right, so when you click on it, if you have a student who has submitted documentation, you will get an email from this site saying that you have documentation that needs approved. If you ignore that email for more than, say, a week, you'll get an email from me kindly asking you to review that documentation. Understand that this student does not get credit for this field internship experience until you complete this documentation. Okay, it will not be approved and it will not show up in their statistics or in their numbers as having completed that shift. Okay, so it's easiest if the student does their documentation during the shift. At the end of the shift, they tell you, I've submitted this documentation for review, and then you log into this and complete the documentation. So I have one opportunity to review, okay? And this was one of our clinics last semester was a flu shot clinic where we went and did documentation, okay? So I'm going to complete my documentation. Now notice I have review, forms, documents, and complete, okay? The review, you could ignore this. This is just information about that clinic, the date and the time, okay? Date and the time. This is the date of the event and the time that the documentation was completed. Then we have the patients who are listed. Now, for a clinic, there's very limited information here. But for your field experience, you will see much more information here, including a section on notes, where the student will document their experience. They will document that patient call. Every event, every time that they document or that they have a field team lead, they should document that, and you'll see that here. You'll see the skills that they performed, okay? In this case, it was just simply administering medications, okay? The student will have the opportunity to evaluate the clinical shift, and when you click on this, this is where some of the notes for each one of those will show up. Now, I did not ask them to document this on their forms for this particular clinic because they didn't really have anything, right? There should not be any kind of documents here because those are not required, okay? Now, if we go to documents here, this is the D section. And if we go out here we have clinical evaluation worksheet. This is your evaluation, okay? This is the beginning of your evaluation of the student, okay? So you select the appropriate number. It's a Bordian scale, 1 to 5. 5 is the best, okay? And I like Taylor, so we're going to give him 5s. If you give the students something lower, I would ask that you write comments. Certainly every student does not get a 5 on every clinical experience, okay? So fill out what it is that you think is appropriate for that student. Enter any feedback, click save. So that how we have a check mark now, that is done, okay? And then we have this. If you want to add any notes to each one of those patients, okay, you can add them there. You can edit them and add whatever it is that you want to do, okay? So you can say whether or not they're competent in any of those. I'm not going to go through all of these for every patient. On your clinics or on your field experience, they're quite likely will be 2 or 3, so you wouldn't have nearly as much as it would be there. So we're done with documents. We'll go to complete. Now, it gives you the opportunity to sign, so you can certainly sign if you want to. That is my signature. You can type a message if you want to, then click Approve Documentation. So now, when we go to our Preceptor home, there is no Preceptor evaluations that need to be done. They are all done, okay? You can log off and go about your business. Again, my preference is that at the end of the student shift, they have completed all of their documentation. It's ready for you to review and approve. You can even use their iPad. All of the students will carry an iPad with them. Hopefully, everywhere they go, they will have a guest internet that they can use to do their documentation. They also have an app they can use on their phone to do the documentation on as well. Okay? So platinumplanner.com and set up the account is where you need to go. Okay? So I'm going to go back to my presentation here. At any points, I have my contact information at the very end of this presentation. At any point, if you have any questions, you can always call me or email me, and I would be happy to provide answers to you. Okay? Remember, the role of the preceptor is to guide the student through the purpose of the field internship. The purpose of the field internship is for the student to be able to manage a patient, to develop a plan and implement that plan for management of the patient. It is not the role of the preceptor to take the call for them routinely. It's fine to let them struggle a little bit, okay? It's fine. You should evaluate that student as if someone were asking you if they could be an entry-level paramedic. They're not as experienced as you are. They don't have the information, the history that you do. So that's how you should evaluate that student. The preceptor should provide a role model for the student, providing quality patient care, caring attitude, and performing well under stress. I understand that you as paramedics, I've been a paramedic for nearly 30 years. By the time many of the students go out in the field, it will be 30 years. And I understand that people have bad days. I understand that sometimes the paramedics don't do things, paramedic students don't do things as quickly or as well as you can. I understand that. I would ask that you let the paramedic students attempt the patient care. If they get in over their head, if they can't handle it, it's fine. It's part of the learning experience. There's nothing wrong with that. Every one of my students will struggle eventually. That's fine. I let them struggle a little bit. It's okay. Not everybody is expected to do things well their first time. Let them struggle a little bit. Okay, it's perfectly fine. Give them information and education. Give them knowledge that you have. Tell them what it is you're thinking as you're going through the call. If you're thinking about certain pathophysiologies, tell them that. If you're thinking this is, or if you want to ask them after the call, why did you decide to intubate the patient or not intubate the patient? That's perfectly fine. You should debrief them after the call. In other words, talk about the call afterwards. What went well? What didn't go so well? Okay? But if your bad day destroys their confidence, it doesn't make for a good learning experience for the paramedic. Okay? So keep that in mind as you deal with the paramedic. You need to be objective as an evaluator for the patient. Recognize that the student has a right to know what their evaluation score is. There's nothing secret here, okay? The student should be able to know what they did right, what they did not do wrong. The students, goodness knows, have gotten enough constructive feedback through this course from the different evaluators as we've gone through to be able to take that constructive criticism, okay? Be tactful with them as you give that. Be honest with them as you give that. But don't be afraid to tell them, you know, that really was horrible. You did a horrible job of evaluating that patient. You completely missed the airway. You completely missed the fact that they didn't assess breathing, and you not once checked for a pulse in that patient. Be honest and open with them and say, that was really not good at all. But be objective. In other words, perhaps you just don't like someone. You just don't click chemistry-wise. That's not a good reason to mark them down on the evaluation. Okay? Again, allow them to struggle. Again, don't compromise patient care. I would never say that. But let them struggle. Let them work through things. Okay? Let them delegate. This part of their training is not so much about gaining skills. Yes, there is some skill work in it. For instance, starting an IV in a moving ambulance would be a good example. But they have been trained to delegate skills. Let them delegate skills. That's part of being a paramedic. Let them delegate different things that other people on the call can do. Okay? Your evaluation and information to the student should come primarily after the call, but again, don't be afraid to step in during the call if that's necessary, right? When patient care is threatened, or when they are so stuck they just cannot move past that, okay? Our role here is to provide oversight of that student. Every call that they go through, I review their documentation. During clinics, we don't review so much, but in field experience, I very carefully review every one of their calls. We provide remediation. If student XYZ has no idea how to start an IV, we will remediate that. Now, I have to know that the student needs remediation first, so you have to tell me. But we start the paramedic field internship around the 1st of May, and it will run until around the 1st of July. If May 15th you recognize that a student is having trouble in a certain area, I can remediate them. I can bring them into the college and say, let's work on this skill. If I need to, for instance, IVs is a good example, I can send them over to Great River after I've remediated them here. I can send them over to Great River, and at Great River they can get some more practice in that skill. But again, I can't do that unless you tell me that they're having trouble with that skill. This is my contact information. You can get me pretty consistently via my cell phone. I did not edit this. My home phone is not operable anymore. We finally cut the cord. So ignore the home phone number. If anything fairly emergent at all comes up, which we'll talk about in the next couple slides, I suggest you call my cell phone to try and get a hold of me there. When to contact me? Okay. There's, you have to contact me right now, and there's, you have to contact me relatively soon, like maybe the next business day. If you ask a student to leave your clinical site, your field internship site, if you ask them to do that for something like a uniform violation, under the influence of something like alcohol or drugs, fail to follow instructions, repeated unsafe acts, okay, and you or your supervisors ask that student to leave, I would ask that you contact me as soon as possible via my cell phone. As soon as you can safely do that, I ask that you contact me via the cell phone so I can follow up. An example, if you think the student is under the influence of alcohol, if you call me on my cell phone, I will have that student report to the nearest hospital we have an agreement with, and I will drug test them. Okay, so we can drug test students for cause. That's an example. If anything else comes up that you think I need to know about, certainly you can feel to contact me then as well. Delayed things, if you think a student needs remediation, if you think they are struggling with a certain thing, if you think they stink and they need to take a bath more often, perhaps you can tell me that in an email that I can get the next business day, okay? Students in general, and this includes EMTs and paramedics. Often, a complaint that I get from evaluators, from preceptors, is the students just stood there. And I have talked to a lot of students in my time here. And the primary reason they do that is because they don't know what you want them to do or what they're allowed to do. For instance, if they do not help wash the truck, or they do not help clean the truck after a call, they may not know that you allow them to do that, okay? So, for the most part, paramedic students or EMT students are eager to learn. Every one of them signed up for this course because they wanted to. So, give them that opportunity to learn. Give them guidance about what it is that you have for them around the area, okay? Give them, if this is the first time in your house, give them a quick tour around there and say, okay, this is where we're at. This is where things are. This is where the bathroom is. Tell them what the rules are for meals. If you're watching as a member of Burlington Fire Department, I tell the students when they sign up, if they want to eat with the fire station, they need to bring XYZ dollars, and then they can eat the meal with the firefighters. If not, they have to bring their own food. Different kinds of things at each station. So tell them that stuff, okay? Tell them what it is they need to know to fit in to that particular system. As I said, if you have any questions at all, please, please, please contact me, and I will do my utmost best to give you the answers to those. Remember what our goal is. Our goal is to turn out good quality EMT and paramedic students, or good quality EMTs and paramedics. You have nearly the last say in helping them be that, okay? As a preceptor, you're sort of the final training option for those. And so you can help them. You have the knowledge to help them, and you have the way, the calls that give them that knowledge. So I would ask that you do your utmost and best to give them that. Again, if you have any questions, call me. My cell phone number is 319-931-2489. My email address is jstefan@scciowa.edu. Thank you very much. Have a great day.